Good evening, everyone. My name is Mark Nordenberg, and it is my great pleasure as director of the Dick Thornburgh Forum for Law and Public Policy to welcome you to the 15th annual Thornburgh Family Lecture on Disability Law and Policy. We are particularly pleased that United States Senator Bob Casey, a committed champion of the rights of people with disabilities, will deliver this evening's lecture, and it will be my privilege to introduce him momentarily. As the name of this lecture suggests, advancing disability law and policy has long been a shared passion within the Thornburgh family. In a life filled with countless contributions to the common good, none was a greater source of satisfaction to the late governor than serving as point person while U.S. Attorney General for the administration of President George Herbert Walker Bush in securing the passage of the Americans with Disabilities Act. His wife, Ginny Thornburgh, who is with us this evening, also is nationally and internationally respected for her efforts to meet the needs of the disability community. In 2003, in fact, Dick and Ginny jointly received the Henry Betts Award from the American Association of People with Disabilities, that organization's highest honor. Consistent with the pattern of their selfless lives, they then donated the funds that came with that prestigious award to the University of Pittsburgh to launch this lecture series. This evening, another member of the family, son David, who is the CEO of the Committee of 70, a century-old good governance organization headquartered in Philadelphia, is going to briefly describe the Dick Thornburgh Disability Award, which has long been associated with this lecture series. David?
Thank you so much, Mark, and thank you for your great contributions to the forum and to the Commonwealth of Pennsylvania and our citizens. There are few, if any, issues, public issues of more enduring importance than those of disability to the Thornburgh family. And I'm speaking on behalf of my mom, Ginny, who the Chancellor mentioned, and also my brothers, John, Peter, and Bill, and their respective families. And Mark noted the landmark accomplishment of the signing of the Americans with Disabilities Act. I'd commend to you a terrific video that was posted on the Thornburgh Forum website this summer that brings that to life once again. And I hope we always hold that in our hearts and in our thoughts. Our interest in this issue, and particularly my dad's interest in this issue, was certainly sparked by his experience and our experience in raising my brother Peter, who, as many of you know, was severely injured in a car accident when he was not more than a few months old in 1960. And that is a demonstration of something that I think we often forget about public servants, which is the role that their own experience and their own empathy plays in shaping their agenda and in providing a true North Star for their policy work. I was reminded of that just a couple days ago. I'm reading a biography that I know my dad would have read, would have in front of him today if he were still with us, which is a new biography about Abraham Lincoln by David Reynolds, which reminds us how important his upbringing and his experiences and the people that he encountered and the experiences he had early on were in shaping his agenda. I'm also reminded of how important empathy is by the terrific work that a young woman, a Pitt student, produced this summer as part of a research grant provided through the Thornburgh Forum. Yamini Yapuri is a rising junior, and she actually did a research project looking at how my dad came to his support and leadership for disability issues because of his experience with my brother Peter. So just wanted to highlight that aspect, another aspect of the great legacy that my dad has left to the university, which leads me to the topic that Mark mentioned earlier. I also wanted to highlight the Student Service Award, the Disability Student Service Award, the deadline for which is coming up October 8th, and brings with it a stipend, an award of $5,000 to a Pitt student who has distinguished his or herself for their ability to make a difference in the lives of people with disabilities. So if you are a Pitt student on the webinar or know of one who fits the bill, we certainly encourage you to get that application in. And finally, I know Mark is going to introduce Senator Casey in a second and his remarks. And Senator, I know how grateful we are and our family is for not only for joining us tonight, but for your service to our nation and to the Commonwealth. And I also want to just say a word about the relationship between these two great Pennsylvania families. I think our collective service and distinguished service is really earns us that title. But also, speaking of empathy, I know how much we appreciated your outreach, Senator, on the occasion of my dad's death, and particularly your mom's outreach to my mother, who said that her letter was one of the finest letters of condolence that she received. So I thank you for, again, your leadership and your empathy and your service. And with that, Mark, I will turn things back to you, and I'm really looking forward to the Senator's remarks.
Well, thank you, David, and let me pick up with that last point you made. Dick Thornburgh, a two-term Republican governor of the Commonwealth of Pennsylvania, was succeeded by Bob Casey, who became a two-term Democratic governor of the Commonwealth of Pennsylvania. That was back in the days when leaders of opposing political parties actually talked to, respected, and worked with each other. And there has long been, as David said, a long, strong, friendly relationship between the Thornburgh and the Casey families. Unfortunately, although the University of Pittsburgh can and does proudly claim Dick Thornburgh as a graduate of its law school, we cannot claim either Governor Bob Casey or Senator Bob Casey as an alumnus. However, there have been long and strong ties between the Casey family and the university as well. The senator's mother, who was just mentioned, was a Harding, and Uncle Jack Harding was a great Pitt athlete. He played football under two legendary coaches, Pop Warner and Jock Sutherland. And he not only was a three-sport athlete at Pitt, he actually captained the football, basketball, and baseball teams. He later became the head coach and first athletic director at the University of Miami, and is enshrined in the College Football Hall of Fame. The connection between the senator's father and the university is even more compelling. In 1991, while serving as governor, the elder Mr. Casey was diagnosed with a rare and life-threatening disease, amyloidosis, which causes the liver to produce an abnormal protein which builds up in the walls of the heart and weakens that organ. There was no known cure for the disease, which had, in the recent past, claimed the lives of both the mayor of Pittsburgh and the mayor of Erie. having received a gift copy of the memoirs of our pioneering transplant surgeon, Dr. Thomas Starzl, the governor decided to give Tom a call. In their conversations, Dr. Starzl suggested that a liver transplant might be one way to improve his condition. Because the heart already had been weakened, though, Governor Casey needed what then was a very rare liver and heart transplant, which he received under the leadership of Tom Starzl at UPMC. After taking a leave of absence, he went back to being governor. And while we all would agree that he died too young by today's standards, the procedure clearly extended his life and expanded his opportunity to make contributions to the people of Pennsylvania. And I don't remember if you were there, Senator, but when your father spoke at the dedication of the Starzl Transplant Institute, he offered some of the most heartfelt remarks I've ever heard. Bob Casey, the father, had served as Pennsylvania's Auditor General for 8 years before becoming governor. And Bob Casey, the son, followed in his footsteps by campaigning for and winning election as Auditor General himself. He too served in that position for 8 years before he was term limited and then was elected to the position of state treasurer. With a decade of distinguished service to the Commonwealth under his belt, he was elected to the United States Senate in 2006 and was reelected in both 2012 and 2018. Knowing the senator as I do, I know he takes nothing for granted, but let me say that none of those 3 elections was close. And he is today the first ever Pennsylvania Democrat to win 3 consecutive terms in the US Senate, and also the first to win 6 statewide elections. Because he was really young when he was elected Auditor General, and by that I mean in his 30s, and I was pretty young when I was elected chancellor, and by that I mean in my 40s. There was a period of years when we were kind of marching through life on parallel tracks. And from that special vantage point, I can say that I have enormous respect for the senator, not only as an elected leader, but also as a person. He has high standards, strong character, a keen mind, and a caring heart. And he not only has the interest in working with other people, he has the kind of unpretentious professional personality that makes that possible. Some sense of his belief that the main mission of public service is to serve those who could most use your help can be gleaned just by reading the first 3 priority areas listed on his website. They are advocating for children, keeping our promise to older Americans, and fighting for people with disabilities. He is the widely acknowledged champion of those with disabilities in the Senate. With respect to that work, he believes that people with disabilities should have the same opportunities as people without disabilities, to secure a quality education, to have comprehensive health care, and to work at a good job where it is possible to be economically self-sufficient. He also believes that people with disabilities should be free from the prejudice and bias of low expectations and limited opportunities. Regarding the important work done by then Attorney General Thornburgh in advocating for the ADA. The senator believes that the Americans with Disabilities Act affirms the civil rights of people with disabilities. However, he also believes that those civil rights cannot be fulfilled without supports. And I know Dick Thornburgh believed exactly the same thing. We are very fortunate to have Senator Bob Casey with us this evening to share his thoughts on disability policy coming out of the pandemic and beyond. Welcome, Senator. It is great to have you back on campus, at least in a manner of speaking.
Well, thanks very much. I want to first salute Chancellor Emeritus Nordenberg for those kind remarks about my background. Mark, I'll try to do them justice and try to live up to at least part of what you outlined. I'm really honored by those comments, and I especially appreciate the you retelling, for those who didn't have the whole story prior to tonight, the connection between the University of Pittsburgh and my family. It is literally the place where my father's life was saved in June of 1993. And we owe a debt of gratitude to the University of Pittsburgh and obviously UPMC and the people of Southwestern Pennsylvania for saving his life and giving him what turned out to be 7 more years of life, almost to the day, until he passed away on May the 30th of 2000. Just to give you one metric to measure what 7 years can mean in the life of an individual, there are lots of ways to measure it, but he was able to see at least 11 more grandchildren come into this world because of those years, and of course, contributed so much. So I'm grateful for that. And Mark, I'm certainly grateful as well for your leadership at the university when you were chancellor, your continuing contributions to the university in Southwestern Pennsylvania and indeed the nation. And I'm really honored to have this opportunity to be able to present some remarks tonight. I'll offer one personal reflection that I could catalog many about Dick Thornburgh and his many achievements, but on a very personal note, just to bring full circle to what Chancellor Emeritus Nordenberg just outlined. After my father had that surgery, of course, it took him a couple of months to get back to work full time. He had the surgery in June of 93 and then came back a few days before Christmas of 93. And when he started back at work, it was obviously a difficult adjustment after having a double transplant. But then fast forward only about 6 or 7 months later, the National Governors Association was meeting in Boston. And then former Governor Thornburgh was, and he had obviously served as Attorney General by that point. He was in Boston as well at the same conference. And I'll never forget, it's just one moment in time and very personal, but I wanted to mention it because my father was feeling better, but not obviously after a long difficult recovery from transplant, not always feeling great every day, but that was his last summer as governor. And Dick Thornburgh saw him in the hallway and really lifted him up, said how strong he looked and how great he looked and what a miracle he was to come back from that transplant. And I'll never forget, I think those words lifted my father's spirits that day and lifted his soul. And I'll always be indebted to Dick Thornburgh for that gesture of kindness for just a few minutes to my father. And then, of course, paying the greatest tribute our family received when my father passed away in 2000, where Governor Thornburgh made the effort, as did Ginny Thornburgh, to be with us on that day at his funeral. So I had to mention that, Mark. You brought me back into time, but I do want to thank you for this opportunity, and I want to cover a couple of subject areas, but let me just start with some introductory remarks about the honor of having the chance to provide some comments at this lecture series, the Thornburgh Family Lecture on Disability Law and Policy. Support for this forum reflects the value the university places on public discourse about issues important to all Pennsylvanians and indeed all Americans. So I want to once again thank David for this opportunity, and to thank Ginny Thornburg as well, and for her friendship all these years with my parents and with me and my wife Therese and so many of us. And I also want to thank other members of the Thornburg family, John and Peter and Bill. I think in so many ways this lecture series is one way, only one way, but certainly a good way to pay tribute to Dick Thornburg's life of public service to the Commonwealth of Pennsylvania and to our nation. To be asked to speak at the first lecture after his passing, and to be asked to speak about a subject that was so close to his heart, disability policy, of course, that is a great honor. And I want to thank you for that. And I want to commend the ongoing work of the Thornburg family, all they do, not only in public service, but also on disability policy. I wanted to start with just an observation that I don't enjoy saying, but I think it's the truth. With rare exception, over the last couple of decades, the Americans with Disabilities Act being one of the great exceptions, too often disability policy in Washington, D.C. Has been ignored. And we're trying to change that over the last couple of years. Despite good work being done by a number of members of Congress in both parties, both houses over time, we haven't focused enough on disability policy. People with disabilities, whether physical disabilities or sensory or intellectual or mental health disabilities, often have been segregated and marginalized, not only in our country, but around the world. Here in the US, when the great landmark civil rights bills of the 1960s were passed, and we included religion and race and sex and age and ethnicity as characteristics that could not be used to discriminate against people. Of course, at that time, disability policy was, or disability itself was not included on that list, not in the Civil Rights Act of 1964 or the Voting Rights Act of 65. It took an additional quarter century before disability rights became part of American civil rights laws through the passage, of course, as we already made mention, of the Americans with Disabilities Act. The then Attorney General, Richard L. Thornburg, made that possible, working with President Bush, the first President Bush, President George Herbert Walker Bush, and their administration. But the passage of the ADA would not have been possible without the good work of Dick Thornburg and so many advocates throughout the country. With his work and the work of thousands across our nation, we finally acknowledge that disability rights are civil rights. Later in 1993, Congress affirmed the idea that this idea of what disability policy must mean to us when it passed amendments to the Developmental Disabilities Assistance and Bill of Rights Act. Here's some of the findings of Congress, and I'm quoting part of it. Quote, disability is a natural part of the human experience that does not diminish the rights of individuals to enjoy the opportunity to live independently, enjoy self-determination, make choices, contribute to society, and experience full integration and inclusion in the economic, political, social, cultural, and educational mainstream of American society, unquote. So said Congress in 1993. So as we talk about, quote, the natural part of the human experience, unquote, every family, every one of us in one way or another will have an experience with disability at some point in our lives, whether it's an aging parent or whether it's a child born with a disability, a soldier returning from combat, as so many thousands have, a colleague who might have a disability, a neighbor who becomes ill, or the experience each of us has personally. We all know and work with people that at some point will have a disability of one kind or another. But just as we continue to work towards racial, ethnic, religious, aging and gender justice itself in those areas of American life, we need to continue to work towards disability justice. So let me share I'll break up my remarks henceforth into about three basic areas. First, I want to talk somewhat extensively about home and community-based services because of the lessons we learned in the pandemic and work we have just ahead of us. I'll also reflect on some other pandemic lessons and then conclude with some comments about the challenge of providing economic self-sufficiency in the context of disability rights. But let me start with the pandemic and home and community-based services. Often, as I mentioned, past policy or policy work have often kept people with disabilities segregated from general society and have limited the opportunities of people with disabilities. Some cases, our practices literally have put people with disabilities in danger. The pandemic, unfortunately, is an example of that. As the pandemic took hold in the spring of 2020, we saw that it was older adults and people with disabilities who were most likely to become infected and unfortunately most likely to die from the virus. A study from Jefferson University released in the summer of 2020 found that the second most likely group of people to die from the virus after those older than the age of 75 were people with developmental disabilities. As the virus spread, we learned that congregate settings were often contributing to the spread of the virus, and people with disabilities in congregate settings were more likely to be infected. At that time, we needed more home-based services to support older adults and people with disabilities in their homes. But the law that created Medicaid in 1965 made it difficult to get home-based services to everyone who wanted them. This has been an issue for decades, of course, and many people who are part of this discussion tonight understand this better than I. But despite it being an issue for decades, it was exacerbated terribly during the public health emergency of COVID-19. For those who are eligible, nursing homes and other congregate services, or I should say nursing home care and services, were available, as were other services for those who were eligible. But those services, because they're required by law, there's no waiting period. There's no cap on those services. Of course, this was not the case, unfortunately, for home-based services. Home and community-based services are provided through a waiver, essentially an exemption to the law. Most waivers have limits on two things: limits on the number of people served and even the categories of people who can be served. Terribly, the pandemic highlighted that these home-based services that most people wanted and would keep them safer than a congregate setting, that these kinds of services were only optional and only available to some. By contrast, the congregate settings that unfortunately led to an outsized number of COVID-19 deaths were readily available and required by law. For a public health emergency like COVID-19, our national policy was exactly the opposite of what we needed as a country at that time. In 1965, congregate care was the standard of care in both the nursing home context itself, but other institutional settings. So requiring the standard of care, nursing home care or congregate care, made a lot of sense in 1965. At its creation, Medicaid included no right whatsoever to care and services in one's own home. Since 1981, we know that waivers have been granted to states to provide some home and community-based services, but not enough to meet the needs of all older adults and people with disability. The vast majority of people who need supports, of course, prefer them in their homes. This is very popular. We all know that, but it's not available to enough Americans. When the pandemic hit, we needed these home and community-based services more than ever. Before the pandemic, and since its early stages, I was fighting to expand access to both home and community-based services. During the pandemic, this work became ever more urgent. It was about keeping people safe. It took us a year to pass even a short-term measure of emergency funding. We started the fight for dedicated home and community-based funding in March of 2020. A full year later, in March of 2021, Congress passed the rescue plan, which, as part of that larger initiative, funded $12.7 billion for additional home and community-based services at that time. These funds are now being distributed to states and beginning to be used to provide home-based care for those in need. But this was, in the rescue plan, the $12.7 billion was a short-term fix, but it was what I called at the time, a foot in the door. First money ever really dedicated in a large, substantial fashion for home and community-based services. These funds were designed to provide hazard pay to help disseminate vaccines to home care workers and to fill the gaps in personal protective equipment, what we know as PPE. What we need now is long-term investment in home and community-based services, an investment that will meet the needs of over 820,000 Americans who are on waiting lists around the country, and the millions more in addition to that waiting list who will need these services. So I introduced, with a number of my Democratic colleagues, specific legislation that was part of the effort, which we're just undertaking now as we come back after the break, to be part of a larger initiative, which is part of the president's Build Back Better budget, in addition to the infrastructure bill. This second initiative will include a major new investment in home and community-based services. So I proposed a bill, the Better Care, Better Jobs bill, that will both expand home and community-based services and improve compensation, wages, for the workforce who provide these essential, even heroic services. It will provide a few $100 billion to meet these dual goals, the goals of more services and better pay for the workers. It's essential that during the continued pandemic, which we're still unfortunately in the grip of, we also need to meet the long-term care needs of people with disabilities, to expand these services and to improve the wages of the workers. These workers make on average only $12 an hour. At last count in Pennsylvania, it was just a penny below that, $11.99 an hour. But because the $12 is an average, in some states it's 9 something or 10 or 11. So that's the wage level that we've got to lift up. The investment in home and community-based services in this budget plan would be, in a word, historic. I'd also add another word. These are essential investments. So we're going to continue working both in the House and the Senate, working with President Biden and Vice President Harris, and both are relevant here, especially to break a tie in the Senate. And we're working as well with thousands of advocates across our nation who are working to make this historic proposal a reality. Nothing like this has ever even been proposed since the creation of the Medicaid program. And it will change the lives of millions of seniors, people with disabilities, and direct care workers. Even as this Build Back Better budget that we're working to achieve, even though it will not equalize the availability of home and community-based services for older adults and people with disabilities, we have more work to do after this. We need to work to change our national policy to ensure that these services are available to those who are eligible for them and who want to receive them. That means amending the law that created Medicaid. It means amending the law to ensure that these services are a required service, just as nursing home and other congregate care are required services under the law. So such a change will make us better prepared for future emergencies and the needs of Americans, especially as our population continues to age. Let me just move secondly to a couple of other pandemic lessons. Number one is that we know in the spring of 2020, when the demand for hospital beds and ventilators was at its greatest, some states drew up plans to limit access to care for older adults and people with disabilities. The plans proposed to use disability status and age as a criteria for denying services to people who needed health care. Such plans reflect the value, or maybe more appropriately stated, the lack of value we often place on the lives of Americans who have a disability. A second example of unfortunate lessons from the pandemic was an instance of bias and discrimination that occurred when the COVID-19 vaccines became available starting in December of 2020. Many people with disabilities face barriers to getting the vaccine despite being more at risk from the virus. The procedures that some states created for signing up to receive the vaccine were through a website, which makes sense for a lot of Americans, but not necessarily for every American. Many of these websites were not accessible to people with disabilities, people who are blind and people who have intellectual disabilities. So inaccessible websites made it impossible for some people with disabilities to sign up for an appointment and get the protection that they needed. A third barrier, or a third lesson, unfortunately, from the pandemic was how states created mass vaccination sites. Here's what happened there. Other people with, often I should say, people with disabilities can't leave their homes without significant planning and expense. The mass vaccination sites were often difficult or impossible for folks to get to. They were in some cases inaccessible settings, and often not accessible by way of public transportation. So I outline these acts of bias or discrimination, not to simply point fingers, but to learn a good set of lessons from the pandemic. Obviously, some of these biases or acts of discrimination were not intentional, but they routinely occur. So we have to be thinking about the next pandemic. God help us, we want that to be far off into the future. But if we have another pandemic, we've got to learn these lessons about how people with disabilities were adversely impacted. So when it comes to a public health emergency or even a disaster, as we're seeing with these terrible storms and natural disasters, flooding and fires and even tornadoes, we can and must do better for people with disabilities. One way to do better is to make sure people with disabilities are included in all of the decisions and that are made when we're developing procedures or policy or processes for emergencies and disasters. And by saying included, I mean actually included, not as tokens or not as committee participants who simply rubber stamp policies. We need to include people with disabilities throughout all of our systems. They need to be leaders and be given the opportunity to be leaders in state, local, and federal agencies. They need to be on panels and boards that create and oversee the implementation of programs. So let me just get to my last subject area, and that's kind of some comments about disability policy and economic priorities. When you consider the number of Americans with a disability, we're told, this is the latest number, 61 million Americans have a disability, but 26% live in poverty, the highest poverty rate of any group of Americans. So when you do the math, that's almost 16 million Americans with disabilities living in poverty, almost 16 million. When it comes to employment or the workforce participation rate for people with disabilities between the ages of 16 and 64 years of age, and you compare that to the rest of America, you're talking about a workforce participation rate of 35% for people with disabilities versus 72% for everyone else. And when a person with a disability does have a job, they earn only 2/3 compared to their non-disabled partners, despite having similar education levels in years of employment. So that has to be front of mind when we're thinking about economic policy. How about savings? When it comes to savings, people with disabilities are half as likely to have at least $400 saved for an emergency and are half as likely to have funds for retirement when compared to non-disabled Americans. We continue to have federal policy that allows employers to pay people with disabilities below minimum wage, a policy that contributes to low earnings for tens of thousands of Americans. These barriers aren't because people with disabilities don't want to work. It's just the opposite. 80% of people with disabilities without a job report they want to go to work. They are overwhelmingly interested in working in inclusive settings that pay at a competitive rate. The problem is we have policies in place that make it difficult for people with disabilities to work in America. Now, we did take a step in the right direction way back in December of 2014 when Congress finally addressed one of those barriers, asset limits for services and supports to people with disabilities. In most cases, those asset limits are just $2,000. That means a person receiving federal disability supports would lose those benefits if they made more than $2,000. We passed the ABLE Act, which was a great effort by both parties in both houses, working with me and with, at the time, Senator Richard Burr from North Carolina. The two of us led the effort in the Senate. We created savings accounts through the tax code that could be used to save up to $100,000, not $2,000, $100,000. And we made it possible for a person with a disability to retain their federal disability benefits, such as Medicaid healthcare coverage. There are now over 100,000 people in the nation with disabilities who have opened an ABLE account, and they've started saving over $880 million. We have more work to do to get more people enrolled, but it's catching on all across the country in all kinds of states. This means they have funds now, a savings account, a tax advantaged savings account for managing emergencies, starting a business, paying for advanced education and other needs to improve their lives. It's critically important that we continue to grow the ABLE program or the ABLE accounts. When the ABLE Act addressed the problem of asset limits, people with disabilities still are at risk of losing their benefits if they earn more than $1,310 a month. These earning limits, also known as substantial gainful activity or SGA, essentially put a cap on what a person with a disability can earn, keeping them in or close to the poverty level. And it isn't only the limitations on our policies that place people with disabilities at a disadvantage. We also limit these same Americans who can go out and find a good job, because Medicaid is the primary health, provides primary health care coverage that most people with disabilities have, and is a state and federal partnership. Applying for service occurs at the state level. If a person with a disability moves to another state, they must apply for Medicaid in their new home state. This means that sometimes they must wait for months or even years to receive the services and support that they need to live independently and go to school or go to work. So the practical requirement to reapply for Medicaid is that a person with a disability is unable to move to get a better job unless they are willing to risk losing healthcare coverage. That doesn't make any sense at all, and we should change that. The bottom line is we've got some work to do, not only on issues like home and community-based services, but also on some of these issues that we outlined tonight. We've evolved over time, fortunately, from a view of disabilities or disability policy from a caretaker kind of perspective in the early 20th century to a civil rights approach in the late 20th century. As we move out of the pandemic into a recovering and robust economy, we need to move beyond the civil rights perspective of people with disabilities to ensure their economic empowerment. Here's what we can do, just 3 quick examples. By eliminating policies that limit self-determination and limit participation in the workforce for people with disabilities, we can take a good step in the right direction. Secondly, by ensuring that both services and supports are available in homes and communities, we can make it possible for those same Americans to attend school or hold a job and participate fully in society. And third, by ensuring that people with disabilities are in positions of power and are in the room, so to speak, when policies are being created and enacted, we can all do a much better job of protecting self-determination and their rights. So we've got to remove barriers to work and ensure a voice for people with disabilities as well. And we have to make sure that we build on the civil rights that were enshrined in the Americans with Disabilities Act. So increasing employment and representation of Americans with disabilities is a critically important body of work for all of us. We've got to build on and really honor the work of Dick Thornburgh and others who went before me, legislating and working and advocating for people with disabilities. We've got to make sure that we're doing everything possible to make it possible for Americans with disabilities to have the full measure of opportunities in our society and to fully live up to the goals of the Americans with Disabilities Act. So, Chancellor, I want to stop there because I know we have some questions, but I know that was a lot, but I had some things on my mind tonight.
Well, it was a lot. And if we were together in one of the large capacity rooms on the Pitt campus, everyone would be expressing thanks to you in a different way now. Unfortunately, you're left with my just saying thanks. But maybe the advantage is we can move more quickly into some of the questions.
Sure.
Predictably, as a thoughtful speaker, you anticipated a number of the questions that were asked, but let me put some to you that are a little bit more on the edges of what you said. Telehealth got a lot more attention and development during the pandemic because it was the only way to deliver services to the general population. But people with disabilities often do have mobility issues. Do you see ways in which some of the lessons developed in that time of crisis can be effectively applied to meet the everyday needs of some in our community?
I don't think there's any question that one of the, if we're talking about lessons from the pandemic, we learned an awful lot about telehealth and the value of it, really the primacy of it as a practice we want to continue and improve upon, because we can provide a lot of good healthcare through telehealth. It's not always going to be a substitute for direct hands-on care and kind of personal, professional attention to an individual, but a lot of people were benefited by telehealth. Of course, that's especially significant in the context of people who live in small towns and rural areas. As you know, Mark, in our state, we got 67 counties, but 48 of 67 are considered rural counties. And so telehealth played a role in delivering healthcare to people who live in areas that are more distant, more remote from major medical centers or places to get direct care. And that's true, of course, if someone has a disability and is living in an area which is far from the physical side of where care can be provided, we've got to make sure that we're taking steps not just to have telehealth available, but make sure the technology is available. That's why the investment in the infrastructure bill is going to be critical for providing more opportunities for broadband, more connectivity, so that folks who need the benefit of telehealth, whether they have a disability or not, are provided that opportunity. So that was one area in the infrastructure bill where we had good bipartisan support. And as for telehealth generally and the practices of telehealth, we need to make sure that people are not only getting the appointments that they need, but also that they're getting the kind of quality care that they should have a right to expect. But there's no question that part of the way you provide that kind of care from a distance is not just making it available to those who might have traditionally had trouble connecting. So investments in broadband are going to be critically important. Of course, it also helps if you're improving and expanding transportation options for people who have to travel a long distance to get to, for example, the University of Pittsburgh Medical Center and other great institutions across the state.
Well, your specific point really underscores one of your broader messages, and that is when you think about so many of these things, we really are all in it together. I mean, telehealth can benefit so many different people and communities, the rural communities that are having a hard time attracting people. And one of the reasons is the absence of quality health care. Another is the distance sometimes from quality education. And the pandemic did also showcase in a bad way the inequities that exist within education today. And of course, there were particular issues about the delivery from a distance of appropriate instruction to those who are enrolled in special education classes. Do you think we can make progress on that front too?
Yes, I think we can. I think we have to. One, if I had to describe the American Rescue Plan in just 3 words, you could provide a good, obviously very general description of the rescue plan in 3 words. You could talk about schools, you could talk about vaccines, and you could talk about people. And that's kind of the 3 broad areas. Because we got the rescue plan passed, that was a $1.9 trillion bill. It allowed us to have the resources that we needed to take on the Delta variant. When we passed the rescue plan in March, by the way, it was only passed by one party. But when we passed that rescue plan in March, we didn't know, I certainly didn't know, and I'm sure some of the experts didn't know, we would be grappling still with the pandemic in the way that we are now with the Delta variant. That alone is a good reason why it was important to pass tens of billions just for a vaccination program that we needed. And then we also passed a number of measures that would fit under the term people when we talked about helping families with the direct payments for the child tax credit that started in July. Those payments started for 90% of families in the country raising children. The $1,400 check, which came in addition to the $600 check in December, the food assistance, the direct help for people to get families back on their feet, help people get back to work was important. And then the third word that I used, schools, that was an essential investment as well. $130 billion is making it possible right now for schools to be open safely. We had a lot of people in Washington finger pointing and lecturing school districts school superintendents and teachers and people at the ground level saying, open your schools, open your schools. Well, it's easy to finger point and pontificate from Washington, but if you're going to finger point and pontificate from Washington, you ought to vote the right way. You ought to vote for the money. A lot of people who were pointing fingers didn't vote for the money to open schools safely. It might be easy to open a school when there's not a pandemic, but it's a lot harder to open a school safely. We provided the dollars for that. And I think we should continue to support not just that kind of emergency measure, but also to make sure that on an ongoing basis, we're providing at least the federal government's responsibility. Mark, you know, for years, the federal government has not met its obligation on special education dollars. The IDEA funding, which the federal government has been woefully short on for many years. The rescue plan helped significantly, provided $3 billion for IDEA, and then also obviously the other dollars for K through 12 education. The IDEA money just this year will be $13 billion, but obviously Congress has a ways to go to meet the obligation that it took on years ago. So whether it's those, rescue plan dollars or continual or year by year appropriations, we got to make sure that we're lifting up our investments in schools. One more point, we know that each year over $4 billion in Medicaid home and community-based services are used to provide therapies to students across the country. So we're talking about those services that I spent so much time talking about. It's not simply about older Americans and people with disabilities who are adults. Those Medicaid dollars also help students and therapies that students need.
In terms of helping students, you are one of 4 co-sponsors, 2 Democrats and 2 Republicans, of a bill that was just introduced near the end of the summer, the RISE Act. And because that deals with higher education, I could hardly have an evening with you without asking if you would say something about that.
Well, it's one of those bills that over time we've had, fortunately, some good bipartisan help, but haven't yet passed it. So that's a source of, I guess, frustration on some days and inspiration on others. But the acronym RISE stands for the following words: respond, innovate, succeed, and empower. That's kind of the focus of the bill. It's as I mentioned, it is bipartisan. We've got both a senator from Louisiana, Bill Cassidy, and a senator from Indiana, Todd Young, working with me and Senator Maggie Hassan, a great champion for Americans with disabilities in the Senate as well. It'll make it possible for students receiving special ed services and accommodations that they can take the information to whatever university they enroll in and be eligible for similar supports and accommodations. So they don't have to start the whole process over again when they begin their higher education. Some universities require that students must get a whole new assessment of their disability and negotiate accommodations such as extended testing time or instructional materials in alternate formats. So we want to make it possible to not have to go through that whole process over again, to take the assessment from their what would be their current setting after their K through 12 education is completed, and use that as a basis for the accommodations that the university would use when that student enrolls in that particular university. So we know that it's a difficult transition enough when you're starting higher education, all the changes in your life as a student. We shouldn't put an additional burden upon students with disabilities. So it's meant to provide a remedy for that circumstance.
Well, the next time we're together, I hope it's in the flesh on the campus of the university, and maybe we can have a longer and more open give and take on these important issues. But as your priorities so clearly indicate, this is a critically important area that deserves careful, constant, and committed attention. And so we thank you for giving it that level of attention. We thank you for all of your other important work, and we really thank you for spending a part of this evening with us. It's been great to have you.
Well, Mark, thank you. And thank you again to the University of Pittsburgh and the Thornburg family. I'm honored.